soon as it's set up.
Are you
Oh.
connected?
Oh, he loves it.
Well, I'll need someone to step
This
up.
brownie's good, it's very sweet.
Mhm.
I don't know where
Yeah.
Jay
You can
is.
only eat
She's
one.
either running late.
Yeah, it is sweet.
You wanna test yours?
It's good.
It's
do we
cloud
test
pie
it?
mixed
Oh,
with
you
the tiger
want?
bark.
Yeah.
Here, I'm doing an audio test.
So, yeah.
Okay, go ahead, test.
Testing, 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 testing. Okay, here you go.
Can you hear you?
Hardly. It's hooked. Why isn't it?
That's what, yeah.
Because the first week we did it, it was perfect.
Mm-hmm.
Let me just check. All right, make sure you're connected.
It's right there.
Bluetooth.
Just push open.
Right
and-
Ah!
in my
Yeah, I
face.
gave up and I said to
Oh,
myself,
not
"I'm
that.
playing with that."
Your pants.
Yeah, probably.
What's your name?
Mia.
Could be.
What is that called?
What is your Bluetooth called?
This?
What's your favorite?
Yes.
These are good.
No.
Yeah, I
Do you know what your Bluetooth
I
is called?
like white chocolate.
It's connected. Dim
Which one
3.
is it?
Is that it? Then 3?
These are yummy.
Okay.
Okay, let's reconnect again.
Okay.
I'm gonna go to Bluetooth settings and see.
Okay, it says, she says I'm connected.
Okay, good. That's a good start. Okay, how do I get? I'm not used to that. How do I get
Not
out
on
of here?
airplane mode.
I want to
right?
go
You're
back.
hearing voices in your
No,
head?
Yeah, you do.
thank you.
I'm just kidding.
Oh,
I
sugar.
have-
Now
I
let's
have
try
voices in
audio.
my head all the time.
Yes.
All right, ready? Recording.
Hey, here we are, Rebecca Klein. We're starting the Enchiridion system.
Can you hear it? Loud and clear.
Not loud, but I can hear myself better than I could before.
Is the volume turned up on that thing?
There you go. A little bit more.
Ah.
Turn it up a little bit more.
Hold on. Hold on. We're gonna test again. Testing again.
Testing, testing. Hormonal imbalances.
Testing. Good.
Yeah.
Ready to
I
go?
think you just needed to turn it up.
No, I did the reduced background noise enhancement,
Okay.
so we'll see if that works. Okay, we ready to go live at 7 o'clock?
Yes. Push them both. Or
Okay.
is the other one already live?
No, not yet. Ready?
Ready.
Oh no, it is. It is.
Whoops.
3, 2, 1.
Hi, everybody.
Hi.
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 I'll give everybody a minute to sit down and relax. Everybody's got their piece of paper. So this is an overview of what we're going to learn in the next 6 weeks. A lot of information here. But every week we're going to take a certain gland, a hormonal gland, and go through it and go over it. And this week I thought we would start with the ones that we know the most about, the ones that your doctors are checking, your thyroid and your adrenal gland. So the thyroid is, I call it like a stranglehold. It's right here. It's small, but it's like a stranglehold on your vocal cords. And if you have any problems with your thyroid, sometimes it actually feels like it's choking you. So that's, and a lot of people choke because of that feeling. Friends, family, if they can't find anything wrong with their throat, but they're still doing that, you could say, well, maybe you need to have your thyroid checked because it could be literally choking them. So we're going to learn about the thyroid and the adrenal gland from the ones that went through the internal organs. Where's the adrenal gland?
No, that's her limbs.
Anybody remember where she is?
I do not.
She's on top of the kidney. She sits on top of the kidney.
Yes, okay.
That's the adrenal gland. So those are the two we're going to hit on tonight. I guess we'll start with we'll start with the adrenal gland. So what does the adrenal gland do? And if you want to look in your paperwork, you'll see under A, adrenal gland. And that way you can follow along with me.
And it tells us where it sits. So if we were looking at
Yeah,
Turn the
your,
page.
your paperwork is for a reason, but yes. But yes. So you've all heard of cortisol levels, and they regulate weight gain, weight loss, your fat burning. They also take care of your salt and water regulation. So if you're puffy all the time, it's not because you have too much salt, it's because your adrenal gland's having trouble doing its job. So the inside and the outside. The outside, the cortex, takes care of your carbohydrates. Okay? So we need to make sure that that whole area is healthy.
Can you say that again? Your cortex does what?
Takes care of your carbohydrates.
Okay.
And when I say carbohydrates, am I talking simple or complex?
Complex.
Very good. Why not simple?
Simple goes straight away. When it hits your
Exactly.
mouth.
Our
Where's
body,
it going?
it doesn't register. It doesn't register. It goes right to your brain. So simple is basically straight up sugars, processed foods, things that our body does not recognize as food, and it's high in sugar.
So what's the carbs that it does take care of? If it doesn't.
Complex.
Simple. Oh,
Complex. So tell me a couple of complex.
Sweet potato.
Okay.
Rice.
Right.
Meat.
Hey,
Hi.
grab another chair. Michelle, a chair. She's getting you a chair. Thank you. Thank you, ma'am. So there's something that I also paired these two because there's something that these two have in common. And people that have never had any thyroid problems or adrenal gland problems, the number one cause is a tragedy or stress. That what kicks us all out of rhythm. So, and I know plenty of people, maybe a divorce, loss of a home, loss of a job, all of a sudden they start having trouble with their adrenal and their thyroid. And stress can actually kill your thyroid because your body is just going nuts trying to figure out what's going on. Even if you're a clean eater, I've seen it happen. So stress is so important to keep under control. So we're gonna, I guess I'm gonna move over here.
Somebody else is here too.
Oh, okay, so we need another chair.
I can sit over there with that.
You could use that.
How about the chair over here?
Your papers.
Oh, yeah.
Just take this chair.
Tracy's gonna be in the
Just so you
video.
can
Hello.
Just so you can So let's
She's in the video.
just
Oh my gosh.
hey, let's just hit again for those who just came in. We know
Oh, she's
our
in the video
thyroid
too.
is
Okay.
here, right here. It's very little, but it's like strangling you. It hangs on like that. And your adrenal gland is on top of your kidneys. Where's our kidneys? We learned that.
In the back.
Right, in the back. Exactly. Exactly. And our adrenal is in charge of our carbohydrates. It's our fat burning machine. It takes care of our salt and our water. It also, we know cortisol. If you have too much cortisol, you gain weight. And our number one reason is stress. Exactly. Move over here.
So that lines up with like what you were telling me like when Chris was in the hospital and I was up there, that it didn't matter what I was eating, it was gonna
Didn't matter.
happen anyway.
Right. Yes, when David was sick, yeah, it didn't matter what I was eating, what I was doing. When your body's on that kind of stress, your adrenal gland just pours out the cortisol. And
What does cortisol do to you though? Like, does it?
how does it make you feel? That's
Yeah.
a good question. That is a very good question. What does it do?
Bottom left.
So, fatigue, headaches, keep going, low energy, mood swings, weight gain, yeah,
Weight gain.
weight gain, and you're always hungry. It's a non-stop, right? It's a non-stop.
But what is cortisol like? I wonder what it's supposed to do. So usually stress response is it's fight or
What it's
flight,
supposed
right?
to do, it's supposed to take care of our carbohydrates, and it is supposed to burn fat. It's not supposed to make fat,
Oh,
okay? So that's what it's supposed to do.
cortisol.
So why does it start making fat when it starts stressing?
You can answer that.
Yeah, he's not looking away.
But why? What's happening to the body? Body does two things.
It's not healing.
It's not healing, exactly.
But it
Exactly.
seems like it does the opposite. Like, it's created to get rid of fat, but it just...
It's just pouring it out. Again, it's
Now,
part
is
of
it
that.
pouring it out, or is it just not doing its job, so it's storing?
No, it's your, if you have your blood work, they can tell you if your cortisol levels are too high. So
it's too much of a good thing.
Yes, it's spewing out so much cortisol. And we know that even though everything works separate, everything works together. So when there's too much of this, then somebody else is working too hard. Our kidneys, our pancreas is working too hard when our adrenal gland is pouring out. Because why? Because it's got to keep the sugar regulated. Because it's all, even though it's separate, it all works together, right? Boy, I don't know what I put in my mouth, but something, I guess, got a hot flash. So where are we? Well, I don't want to talk about this thyroid yet. So what are some of the foods that we need? And I had this asked the other day. Becca, I want to take a magnesium supplement, I want to take a zinc supplement, and I'm like, why would you do that? Why? So what's some zinc foods?
Zinc.
Leafy greens?
Nope.
Apple cider vinegar.
Beans,
Salmon, fish.
nuts, meat.
Okay.
That's what's zinc. How about magnesium? Now say it.
The leafy greens.
Your spinach, your nuts, your kale. And this is something that, this is what we've been talking about with a lot of our body needs Brazil nuts because of the selenium. We have talked and talked and talked about that. So,
I'm
yes.
finally eating Brazil nuts.
Why not?
Finally.
Yeah.
I think mine came from some study about thyroid
Okay.
and Hashimoto's.
Yep, it's good, but yeah, but we need those, so we eat those, and of course fish and your apple cider vinegar. These are just some foods that we eat, and it removes sugars, glutens, and dairies. So if you look at overall and the way we eat, we get all this stuff. We get this stuff, right? So any questions about the adrenal gland, and if it's not working right, then the pancreas takes off and throws out more insulin. And what happens then? It moves.
So wait, these foods, if I eat these foods, it'll help my adrenal gland, the health of my adrenal
Yes, it will.
and other glands.
Yes.
Probably as well.
Yeah, exactly.
Now, if you eat more of these foods when you're high stress, does it help
It does.
reduce the
Yeah, the cortisol.
the,
So-
the
Nice.
cortisol,
What's a
like
healthy food to reduce?
like if
stress?
I'm eating, like if I know I'm gonna be stressed, be like, okay, well I gotta make sure that I'm getting this and like
So treatment. 8 hours of sleep.
I like that
You're
one.
not getting, if you're stressed out and you're not getting 8 hours of sleep, your body's not healing to its
That's true.
potential.
I don't think I've had 8 hours sleep in 6
Yes,
years.
since my kids were, before my kids were born.
That's something we have to, you have to work on.
no, I have a
And
question.
we say speaking the truth to ourselves. What's your question?
Okay, so I have my ring monitors my sleep.
Okay.
So do we want you say 8 hours, but like I know.
Are you sleeping? Are your eyes closed?
Well, my eyes are closed, but when I look at my thing, it shows me like when I'm awake through the night. Like I don't remember, but
Right.
it shows me that I'm up and down and like. So we need to get that because again,
Small.
like I'll go to bed at 10 and wake up at 7. That's 9 hours that I close
But
my eyes.
I
But
would
then
say
I
that
look
was
at my
restful sleep, right?
if I look at my tracker, it'll be like, oh no, you actually got only 7 hours of sleep because, you were up a minute here and 2 minutes here and 3 minutes here and da-da-da-da-da-da.
But you didn't feel like you were up, right?
Sometimes I do,
Sometimes you do.
sometimes I do.
Alright.
So like sometimes like if I wake up and I'm like, oh my god, why? And I'll be like, oh, okay, that's why I was tossing and turning and up and.
Yeah, it's important to try to get your 8 hours of sleep. And exercise always, but not a gym rat. Just relaxing, nice walk, bike ride, 20 minutes, not hours, because then you're putting more stress on the body. And that goes with both. That goes with the thyroid, and that goes, and eliminate alcohol. That's high on the list. So if you look at those symptoms and you look at these symptoms, one's thyroid, one's an adrenal, they're pretty close. They're pretty close. Now, when you have insulin resistance, you've all heard of that, right? So to find out if you're insulin resistant, and we're always talking about keeping our glycemic index right here. But if you have insulin resistance, protocol says to eat within an hour of you wake up, and it has to be high protein. And then all through the day, you make sure you're never hungry. And the number one thing is vitamin C. So you would eat a small fruit throughout the day to keep that. That's if you're insulin resistant, because your pancreas is not working properly. And we will go into that more, because a lot of us are insulin resistant and we don't even realize it. Especially if you're having trouble dropping weight and if you're always hungry, because the vitamin C in your body that your workers need, they'll ask you for it in any form, right? Your sugar, your energy in any form that they can get it. So now let's talk about the thyroid. So, of course, there's Hashimoto's. That's extremism. So we have hypo and hyper. So you would think hyper would be an overactive, but it's not, right? So we've got hypo is your, oh no, I lied. Hypo is your underactive, and your hyper is your overactive. Does anybody take thyroid medicine and go to the doctor? And because they'll take blood work and see what your T4 and your T3 is.
I get it checked.
I do.
I don't take any meds currently. Close.
Yeah,
And I take meds, but they only check it once a year.
So the thyroid takes care of so much. If your thyroid's out of whack, I mean, it even makes your heart beat. I mean, that's pretty cool that those hormones make everything work together. And I got that wrote down here somewhere. Give me a minute, I'll find it. So we'll go back to what happens when your thyroid, obesity, joint pain, and infertile and heart disease. It takes care of all that. And I'm just gonna hit on this, but your pituitary gland, if this is not working, if your thyroid's not working, this spews out TSH, and we'll go over that later when we get there. I just wanted to side note. So if your thyroid's not working right, then your pituitary gland throws out hormones that it's not supposed to. So that's where it goes. And again, what causes it? Stress, infection, leaky gut, which we work hard on, and inflammatory foods, and we will learn about disruptors. And a lot of our food have hormone disruptors in them, which just raises havoc on our bodies, especially women.
Food and, soaps. and
Oh, yeah, oh, yeah,
moisturizers and
makeup,
lotions
soaps.
and makeups, there's so much.
Exactly.
Look at that
Exactly.
lately, and it's a lot of endocrine disruptor and those kinds of
And the
things.
symptoms, fatigue, depression, weight gain, thinning hair, cold feet and cold hands, dry skin and puffy face. So puffy face is from the water regulation.
Tracy's like, I got that. I got that.
Check, 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 check.
And you're always cold, and you're always cold.
Check,
We
check,
should
check,
also-
check.
And we're all sitting here with jackets on.
Not
Yeah,
me.
not-
I'm
yeah.
not either.
Not
I
me.
don't know that.
I don't know,
I
that,
just like
that
wearing
chicken said it was
sweaters.
clean that I got, but it must not been, cause
It lies.
see, that's my hormones. When I put a disruptor inside of me, I immediately have a hot flash. And I only have hot flashes when I eat something not clean.
Is
So
soy,
that pizza chicken was clean, and they lied.
is soy a disruptor?
You betcha.
Yeah, that's,
You
that gives me
betcha.
hot flashes.
Pizza.
I can't have
Oh,
soy.
you didn't make that pizza?
Yeah, I made it, but I bought the chicken. Yes, I made it.
She made the crust out of chicken,
I made the crust out of chicken.
so she's
So
saying,
what wouldn't have been clean?
I don't know, but it's
Oh,
the clean. The chicken itself wasn't clean.
Yeah, the hormones that they put in the chicken.
Did you use a different type of chicken?
I used Purdue, what I always use. But I'm just telling you, I didn't touch anything else over there. So, anyways, so where were we? So here's our thyroid. What does it do? It's supposed to regulate our metabolism, and it also gives our bodies the ability to break down food and convert it to energy. So like I said, your thyroid does a lot. And we went over the symptoms, and we went over the treatment, and there's a picture of the inside of it. If you look at your picture there that you had, you got the outside and you got the inside. And the cool thing, just like everything else we learn about,
First stage.
everybody has everything filters, right? Everything filters and cleans everything. I don't think we went through one organ that in some way doesn't filter and clean.
Probably only the brain.
We haven't got there yet.
That probably doesn't filter. Oh, but it does, she looks at me.
I do have a question, Miss Rebecca.
Yes.
You know how sometimes you go to the doctor and they always tell you, do you have any of, like thyroid, does thyroid run in your family, or does high blood pressure, or heart attack, or cancer, and all that stuff? So why do they ask if say, you see how the thyroid is, it can be, because we're learning about it now, I understand what thyroid is. But whenever you go to the doctor, they're always like, does anybody in your family have thyroid issues? And then that's when they test you for that.
Right.
So it's not genetic,
It's not genetic.
see?
So I'm gonna let my girls answer that question because they know you know that answer.
Well, it is kind of genetic because you are created from your parents, so
Correct.
you get a little bit of both. So you know, you may have, one kid may have more of from mom or more from dad, but you do have the mixture of your families going back. So genes. It's just in our genes.
Correct.
So you're saying that thyroid is genetic?
I'm thinking anything, it could be genetic, because again,
What about?
100 years ago, were they
What about-
testing for thyroid and this and
So
that?
what
You
about
know,
generational eating
Yeah,
and
that's what I was-
generational
I was
living?
gonna go
Because
there
our
too.
grandma
Yeah,
taught our
you
mom
know,
and our mom
that-
taught us and we're
yeah,
teaching our
just the
kids.
way you're, but
Family.
also your environment and
Exactly.
that sort of stuff. Like,
I would say, I would think no,
It is no.
because.
Yeah, exactly.
It is
I would
no.
say
knew
no,
was a
it's
no.
not.
it's no, but again,
It's more of a taught-
Yeah.
Top thing.
It is.
Nobody
With your
in my
experiences.
that we know of.
Yeah.
Like for me, I'm learning this now because you're making sense, and all I'm thinking is of like, you know, my family history where they're asking, you know, who in your family has thyroid? I'm like, there's like 5 people. What about heart disease? Well, 2 people.
Right.
Like, you know, and then I think back on my husband's family, and I'm like, wow, like because they typically say African Americans.
Right.
They all, it doesn't matter, you can attest to this too. They all have high blood pressure. No matter what, they say it. All Africans, they have high, do you have high blood pressure?
No.
So you're lucky.
But that's because
But they all-
that has a lot to do with
it's-
what they're eating.
And
That
stress.
too, and stress.
And stress.
And that's what I
Because they do
tell my
stress
husband as well. I'm
differently.
like, it's not what you think it is. I'm gonna
'Cause
start
my
going to these
daughter-in-law
classes
cooks
and I'm gonna
fried
teach
chicken.
you.
Yeah. So, generational eating
Yes.
and generational environment has a lot to do with everything that goes
Because
in.
it's a different food that back in the day that you
Yes.
used to eat. And I told, like, you know, when I started dating my husband, I'm like, hey, this is how I eat.
Right.
Like, cut the fat off and
But
that's why
there,
we talk
but there
about eating
is,
while there's an
I mean,
eating
there
stuff.
is birth defects.
Yes.
I was born with my mom's heart.
Okay.
But we also have my dad's heart where the wall in the middle is
Yes.
either gone or in pieces.
Mm.
My Heather has a hole. Well, now they patched it, but she's got a.
I understand
but
what you're
yeah,
saying.
yeah. But my.
But that's genetic.
that's genetic.
Well, yes.
Yes.
But see, that's what I mean with the thyroid and heart disease. Heart disease, yes, it can be genetic because you just explained that
Yes.
situation. But with the thyroid, no, it's what you eat and the stress and all that other stuff.
Right. Right.
That will cause your thyroid to go out of whack.
And if you watch a person over years and then they have a heart attack and you see how they have, how
Eaten.
and lived,
Yes.
then it's understandable. When they get in, they find a defect. That's different. That's
Mhm.
what they found with me when I had my first heart attack. So I hope that answered your question.
No, it did.
Okay.
No, it did. Like I said,
Would-
it totally
So, the doctors don't really want to test for things unless it's genetic? Or do they are they lazy? Or do they think insurance isn't going to pay for all the testing, so they try to eliminate things?
did. It's all money making.
Exactly.
I'm sorry, I don't go. I do not go to the doctor because of that reason, unless I really have to.
I go once a year. I work with a lot of doctors, so
I get it.
so there's a reason for everything
But
they
the thing
ask.
is, you have
Yes.
a situation where
Yes.
yes, you have to go. But like
Yes.
for me, if something is deathly wrong, then yes, I'm gonna go. Like my kids, yes, I'm gonna take them every single year to go get tested because those are my babies. Yes.
Yes.
But for myself, I'm like, if something's not, no. The last time I went was like 3 years ago when I had my partial hysterectomy done.
Okay. I go every year just to make sure
Yes, ma'am.
things get better and better and
I
better.
wanna tell you something though, as you get older, every doctor that you say that to, they say, there's no such thing as a partial hysterectomy.
Okay.
Yeah.
Whatever, they
Yeah,
take
yeah.
everything out.
Yeah, I wrote it down several places and they're going, oh, so you've had a partial hysterectomy, and I'm going, yes, I did. And he said, well, what exactly do they take out? Because there is nothing. No, that doesn't describe any of it. So I'm like, well, I think they took this out and they had a lump there. And I said, does that explain it? And he said, well, not much better, but I thought, well, why would you ask an uneducated person about you know, he's the one supposed to be telling you, but anyway.
I understand what you're saying.
Yeah. So there's another word for it. That's cool. Yeah.
We went
I'm
from,
sure you can have like several meetings just on the same subject.
Yeah.
True,
yeah.
true.
Yeah.
But I mean, every doctor, there is room for doctors. I wouldn't be here without my Dr. Patinsky. I
I
wouldn't be here,
understand.
you know. So yes, there is times and places for them.
correct.
But with, yes, you can too. I'm trying to teach you so you don't have to run to the doctor. And if you do, you understand what he's saying.
Yes.
You know, if they would ask me if there was thyroid in my family, I'd say, what's that have to do with anything?
But that's what I asked them, and then they give me a face, and I'm like,
Well, that's because they don't want questions.
that's right.
Sometimes. Okay, we need to move on, or I get in trouble there. Okay. So, anyways, do we have any questions? I think we went over everything. I don't want to move on because once we get to the brain, that's a whole different story. But these are the ones that you guys hear about every day. You go to the doctor, they ask about, you know, how many people do you know have thyroid disease? You need to look at their lives and the way they eat. Hashimoto's, see if they smoke, because that's the number one cause. If they already have thyroid disease and then they smoke, you can get Hashimoto. And we'll get in, that's a whole lesson, Hashimoto's and what you have to do for that. So as of everything we've discussed on,
Can you go over the pancreas more? I know you said your body not making insulin, but
okay, so this is hooked to the adrenal gland.
okay.
So if the adrenal gland is working overtime, then, because it's supposed to be burning fat, which causes energy, which is sugars in our body. Well, and if it's not doing that, then our pancreas, which makes insulin, right,
Mhm.
has to work harder and make more.
Okay.
Okay?
I've heard like someone's like you can like burn out your adrenals, like adrenal glands. Is that like a thing where it just
I have never heard that.
someone it was a
Burn
while
them
back.
out.
Not burn them out, but like just you put too much
Like
on your
exhaust
body and your adrenals just I don't know
You
fail.
mean like exhaust them?
I guess, yeah. Like,
Well,
is that
anything in your body
possible?
can be overworked. Anything.
To where
so-
it
Can
just
it
stops
kill it?
working?
So
Or like
stop working.
Or
I've never
pause.
heard it, but pause. I mean, I'm not going to give you an answer. I'm going to find out the answer.
Alright.
But I have never heard that. But we know with any organ or any gland in our body, you know, if it's overtaxed, there's a consequence for it, right?
Stop working.
So I would say the adrenal and the thyroid and, you know, the kidneys, we all know there's a price to pay for not taking care of our body. And what did you call it? Overtaxed?
Burn out or
Burnt out.
some
Okay.
kind of, like,
I'll have to write that down because I have never heard that saying. But like
yeah.
anything else, if it's spewing out cortisol and not doing its job, and you know, if you're super stressed, see, I would go back to what we learned with our immune system. That would kick in, and then first thing you know, you've got thyroid cancer or adrenal cancer. Does that make sense from what we learned last time? That if anything's overtaxed, we know our minions go crazy and try to take care of it, right? And if they can't take care of it and it gets all boogered, then we got some cancer or
So is that where cancer's coming from? Like the overworking and then our minions or professors sending
that's
out?
one. We did learn that. That's one reason. The other is environment, toxins,
Unicare.
right? It's not all.
Number one.
It's
So
not all
things,
because they
hiccups.
have overreacted.
Do we have cancer like cells in our body?
They say we do.
Yeah, they
American
say we
Standard
do.
Diet and the way we live,
Mm-hmm.
and that could be generational. I don't
Well,
know.
there's a lot more toxins in the food now than there was.
Oh, absolutely.
Oh, yeah.
20 years ago.
Right.
30 years
Probably
ago.
ever since I was born, they just started
And
adding
Cancer
more
was
and
like, oh
more.
my God, someone's got cancer.
Now
it's
everybody,
just, it's
yeah,
just like,
all of us,
Yeah.
sitting
Yeah.
around
Yeah.
with somebody that,
Yeah.
somebody close.
It's like
somebody
a cold.
Absolutely.
Common cold nowadays.
Right, right.
5
exactly.
weeks.
Too bad.
To get no, you're talking about the common cold, and I'm like, you not like back in the day, like two weeks, and you're like, fine. Now it's like over and over time.
Okay, so we're done here.
Yes, ma'am.
Everybody's happy?
Mhm.
If you wanna take a picture of it, cause I'll just be adding every week. So there, did you guys remember to bring your paperwork from last week? And who didn't get their paperwork from last week?
I
did.
did.
I wasn't here.
We didn't have paperwork last week.
Yeah, we
It
have
was a-
review.
It was a review.
Yeah, we had a review.
2 clocks.
2 clocks.
Yes, the 2 clocks, it's in my
Oh.
car.
Oh, yeah.
You got it?
No.
I have it, I
I
don't know
have
where,
enough.
but I have it.
I have it this home with my phone.
Thank
Okay, I might have
Oh my
enough.
God.
You got without
Phone
nothing
line,
today.
right?
Not yet. It's
But
coming.
it will be.
I have one in
I
my
have you get
car. It's in my car.
Did you grab one?
I do have one.
So we've been working on 2 clocks. There we go. Fireplace is going. And you guys' homework was, your homework this week,
Sit there.
your what?
She's so cold. I'm like,
It feels nice in here.
I'm fine with it.
You know your cat's
Wanna trade
outside,
seats?
right?
You're a
Yeah.
Florida girl.
I was
What you are.
A-okay until
I told her
all
not
of
to
a
shut the
sudden
door.
the
The lights turned
lights
off.
went out
It's
and my,
It's your mind.
my
I
body
can't
just
hear
said,
you.
oh, okay, time to chill
You said your cat might fall in the pool last
I
time.
know, I'm watching him.
Oh, okay.
I'll go in
You
there and
see
get
her
I
it.
hear a splash.
Splash. Yeah.
Swimming.
You turn the light on.
I got him.
See
I'll
him
go
out
get
there.
It
off
doesn't
here.
weigh very much to make a very big splash.
He's out there somewhere. Yeah, he come out and walked right out there.
You came flying out here. Bam.
I know it. He's been
You
acting
might have a
pretty
little
weird.
girlfriend out there.
Ooh.
So, yeah.
It took her a second.
Yeah.
No, he came out pretty
Oh,
quick.
add a little drunkenness.
Yeah,
Stuff, huh?
I did.
He had a pep in his step.
So our work was this week, our homework was this week, if you caught yourself so busy that you were stressed and just out of control. How's everybody's week go? Did you find yourself off the top? Everybody did well?
I did a good job this week, yeah, and I made a point to do my 15-minute meditation in the morning, and yeah, good. I've been really
Chilling.
really good with this time change. I've just accepted it and just following it back. It's been good. I go to sleep earlier, I wake up earlier, getting 8
Anybody
hours
else?
of sleep.
Had a good week?
Nope.
No?
Mm-mm.
No. So you're having trouble separating?
Well, just what Rob went through last week was
Right.
very,
Right.
very scary. So, but I think everything is fine now.
Okay. And keeping your work schedule while you're trying to take care of him can pile up.
Yes.
It can pile up. So I told my story last week, I'll tell it again. So I come home from vacation and I had a dozen things I had to get done before noon. Well, on Tuesday I do Bible study, and that day there's Bible study, there's lecture, and they were having a luncheon. So I was trying to figure out, and I had to be back here at noon because we work in the office on Tuesday. So I was trying to figure out how I could get these 10 things in and be back here by noon. So in my head, I'm going, I'm going through my, okay, so I can go to Bible study, during the lecture, go do these things, come back for the lunch, or I can skip the Bible study, go to the lecture, and then go to lunch, or I was trying to fit all this stuff in, and the voice says, don't even go to Bible study. So I said, nope. So I went, I did Bible study, I did a lecture, I did a luncheon, and I got all 10 things done without hurrying. So, it's important to put the voice where it belongs, right? And to prioritize what's important to you. Because then everything else will fall in place.
Well, that's what I did last week when my husband came home from the doctor, and I said, everything okay? He goes, no. He goes, he has a pacemaker. He got a pacemaker put in February. He goes, something's wrong with the pacemaker, and my blood pressure is really low. So they want to see me first thing in the morning. So we both freaked out. It's like, how does a pacemaker not working? Well, his heart, something happened with his heart, and they had to recalibrate it, which I've never heard of such a thing.
Oh, gosh.
But it's like, so now we need to be very careful of all that. But I had BNI in the morning, and I wanted to go with him to the doctor in case they had admitted to the hospital, and I had all this stuff going on, but I just put everything aside and went with him and said,
Yeah. And it
did a
worked.
phone call with you
Yeah.
instead of seeing it in person. But it all worked out.
That happened to my cousin's husband, but they didn't have to recalibrate the heart. He actually needed a heart transplant, or else he
Oh.
would have been dead in 3 months.
Wow.
So they found him a heart, went and did it, and he died from that transplant.
Oh no.
And they tested it. That's why I have the thing with, because because they tested everything. They tested the heart. They tested his heart. They measured everything, made sure his kidney could handle all that, and it just
His body rejected
his
it.
body,
And we
Totally,
learned that
totally
last month
rejected
about
it.
rejection.
and it's like, it still affects me because it's been a long time. And after he passed away, my cousin, who was 34, died from a brain aneurysm. So, and then it was just like a domino effect. And then an uncle of ours that we were really close to passed away too. And it's just like, what is going on with this? And when you're talking about that whole heart thing, I'm just like, oh, it just reminded me of him. I didn't mean to talk about it, but I'm glad at least they're looking into that
Yeah.
and not saying that, okay, he needs a heart transplant.
Well, he became a paraplegic 3 years ago. Now it's almost 4 years. So everything is different. Like, his whole body just reacts differently. And he hasn't been feeling well the last couple weeks. Now we know why.
Yeah.
So anytime he's not feeling well, I'm going to take him right to the doctor, the heart doctor, and say, make sure everything is cool.
Right.
But he bought one of those things that go on your finger that shows your
Pulse oxygen.
your oxygen
Blood
level.
oxygen?
Yes, yeah. So
He doesn't
Wondering
have
if
a
those
monitor by his bed. When I had mine, it was I had a monitor by my bed.
he's a man.
Okay.
We get that.
So my favorite part of this poem, I guess, is you feel like you're sprinting on a treadmill that's not even plugged into the power source. I like that. I like that part of it.
Yeah.
Because, they say hamsters on a hamster wheel, but the hamster wheel is moving. What if you're just running in the same spot and nothing's getting done? And I know sometimes we get so busy. Yeah, you remember those days where you just all day and nothing gets done. So I want you to continue to work on that. If you find yourself overwhelmed and not getting anything done, just stop, step back, and it says reset the rhythm. Reset, turn off every device, walk in silence for 10 minutes with each step whisper. I move when heaven moves. Let that become your mantra. I move when heaven moves. Speak it until it's real. Say it out loud 3 reps. God's not late. I'm not behind. I'm moving in divine maturity. So just knowing that things will work out the way they're supposed to, no matter how long your list is. It does get done. What's up, buddy? What's up?
He's agreeing with you.
yeah, him being out here is just unreal. So how many people look at their calendar every morning to see what they got to do?
All of us, pretty
Okay.
much.
At night before I go to bed, and in
Yeah.
the morning when I get up.
All right.
Friends can testify to that too. I don't know how many times, and I'm just like,
I would like to get up and not look at it.
yeah. But
I
you
do
have a
too.
lot, sis.
I do too. I
You
do.
both
I
have a
get
lot.
up on Sundays. I look at the week and put it in my head, and then every morning I get up after my meditation, my prayer. Then I walk over and I'm like, what am I supposed to do today? Because I forget what I'm supposed to do. But I have been working real hard on slowing things down because things can get real complicated and crazy real fast. And we work real hard on our stress level, really hard, because we have learned not only our hormones, but our body does not deal with stress. And we need to reassure our body that we're okay. Every time we take a big, big, deep breath in and blow it out, that gives our body, our workers, a signal that we're safe and we're fine. That's an automatic response. So that's why when things get out of control, we stop, we look down, we take a big deep breath and blow it out. And that's why we're calm, because we've told our workers that everything's okay, that we're safe, and whatever the situation is, you can handle it easier. We can also drop our blood pressure 10 to 20 points just from breathing. My doctor yells at me because I work on it all day. So when I go in there, my blood pressure is low. And then he yells, would you put that out? But
I did that with my daughter this weekend. She called me Saturday, I think, and was very stressed out about something that was happening in the moment. And a lot of it was what she was kind of making up in her head. Like
Okay.
it was with somebody else, but she was like, I'm thinking she doesn't want to do it because of blah, 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 blah. And I'm like, okay. So then we were talking, and as we're talking, she's getting more and more
okay,
and more.
you can hear it.
I was like, okay, you need to stop right now. I go, wherever you are, just stop and sit down. I go, I want you to listen to my voice and do what I say. And I was like, I want you to breathe in through your nose. She goes, I can't breathe in through my nose, it's too stuffy. Okay, then breathe in through your mouth and just take the biggest breath that you can and hold it and then just blow it out really hard. And I just walked her through it, and it was maybe 2 minutes. And then she was able to have a conversation, see things from a different way. And then she ended up talking to that person later that night, and it wasn't all the things that she made up in her head that it was. And she was okay, and it was just
And
getting
teaching
through that
her,
moment.
yeah, and teaching her that now.
Mhm.
She won't be 50 years old and, being a berserko. And even my grandchildren, I'm teaching them, you need to step back. What's the problem?
Right.
I don't know. Okay, then we just need to breathe it out, and then maybe you'll know.
Hmm.
So, yeah, how we doing?
7:45. You're okay.
Oh, we're doing good. We're doing good.
Your mind is a powerful thing too. Like, that one in there, sometimes she'll get stressed out and I'll tell her, step aside, just go to your room, take a deep breath, you need to calm down.
We need to teach them if there is nothing, if it's not controllable,
And
then
that's what
they
I say
need
to
to walk,
That's
to let it go.
Exactly what I
Because
say to her.
actually, there's only one thing that we can control.
Yourself.
That's
How
our
you
mind.
react to
That's
it.
it.
How you react to it.
That's it,
absolutely.
Our own mind.
Yep, because, and we've all walked the walk where we thought we could control everything. I mean, I'm right there with you. I spent 30 years thinking that I could control everything. I look back now and I really didn't control anything. It was just, like you said, you can't breathe, your anxiety's out of control, let alone your depression. You have to learn just to let go And, you can't change anybody, you can't rewrite, you know, the situation.
No.
You can just deal with it on your,
Oh.
here, how you would deal with it. And, you know, we talk about the darkness a lot, that these things that we have going on in our head, like you said, she rewrote it. Well, she wasn't rewriting that.
The brain.
Those were just, you know, ideas thrown at her to get her worked up. Because the darkness, that's what he does. He wants to keep us worked up, keep us sick, keep us wondering, keep us not living our best life in peace and grace. All right, so we're gonna breathe. Who wants to do the music today?
You got it.
Give me some music. Wrong kind of music.
That was kind
That was Nintendo.
Fireplace, feet flat on the floor. Remember, every time we breathe out, we are releasing inflammation. If you have any joints that are hurt, try to stretch them while we're doing our breathing. That relieves the inflammation wherever it may be, your hands, your wrists, your knees. And we'll go from there. And if you're feeling a little stressed, make sure you breathe out hard. Let's breathe out all the anxiety and stress from the day. We'll start, big deep breath in. Breathe out hard. One more, big breath in. Breathe out. Breathe normal. First set, breathe in. 2, 3, 4, 5. Hold. 2, 3, 4, 5. And release. 2,
Bless you.
5. Breathe in. 2, 3, 4. Hold. 2, 3, 4, 5. And release. 4, 5. Last one. Breathe in. 3, 4. Hold. 2, 3, 4, 5. And release. 4, 5. Breathe normal. Let's put our chin to your chest. Right ear to right shoulder. Up to the sky. To the left. Back down to your chest. Breathe normal. Back to center. Big deep breath. One more. Second set, breathe in. 2, 3, 4, 5. Hold. 2, 3, 4, 5. And release. 3, 4, 5. Breathe in. 3, 4, 5. Hold. 2, 3, 4, 5. And release. 4, 5. Last one, breathe in. 3, 4, 5. Hold. 2, 3, 4, 5. And release. Breathe normal. Put your hands down to your side and wiggle your fingers. Just picture a waterfall. Picture you're standing under the waterfall. The water's running under your head, down to your chin, sliding down your neck, over your shoulders, down to your elbows, to your wrists. Feel running out your fingertips, wiggle them. Big deep breath. One more, big. reset, breathe in. 3, 4, 5, hold. 2, 3, 4, 5, and release. Breathe in. 3, 4, 5, hold. 2, 3, 4, 5, and release. Last one, breathe in. 3, 4, 5, hold. 2, 3, 4, 5, and release. Breathe normal. Come back to center. Quiet your body, quiet your mind. Big deep breath, blow it out. One more. Do our mantra. You are safe. You are safe. You are loved. And you are never alone. You are safe. You are safe. You are loved. And we are never alone. We are safe. We are safe. We are loved. And we are never alone. Big deep breath. One more. And come back to center. And when you're ready, come back to us. You're paying attention to your breathing when you take your deep breaths to see if you can get it deeper and deeper each time you do your prayer meditation. We've been working on our breathing technique to hold, see if we can hold it. 30 seconds because lung capacity goes with Alzheimer's and circulation of our blood and getting more oxygen into our blood. So just the basics of breathing is so important. And there we are. Right on time. We'll see everybody next week. And if you don't have a menu made and you're at that point, text it to me. And yeah, take your paperwork. I don't know what organ we'll work on next week. Oh,
I won't be here.
you won't be here next week? What is it? Oh, it's Monday.
Oh, yeah, they won't be
Monday.
here either.
You guys are going,
Yeah.
going away?
The Charbonneau clan
Okay, so
family.
1, 2, 4. Okay.
3.
I should be here, but we're driving back from Gainesville that day. Chris has a doctor's
Oh,
appointment.
okay, so that'll be a long day.
Yeah.
Okay. Well,
But
we'll be
we
here.
should, I mean, his appointment's at noon, and then we're gonna come home, so
Okay.
I should be.
Oh, what was I gonna tell you? I forgot. All that breathing, all that good oxygen. Oh, you can go have a basic woman's panel done and a hormonal panel done up here on Toledo Blade. I'll tell you the name of it. $200.
Yes.
Yes, $200 for all of that, and that's pretty good. And you just go in and tell her you're with Yes You Can Too, and she emails it to you, and then you bring it to me.
Okay. Sounds good.
Alrighty, thank you so much.
Thank you.
You're welcome.
Oh, boy.
Uh-oh.
Oh.
Oh my
Do
goodness.
you want this
We're
started?
gonna have everybody sleeping here pretty soon.
before we get popping as we get up.
Oh my God, one piece of pizza.
I don't know how to finish up there.
No, it says live still.
What is that?
You see it?
Where is it?
Yeah, I
They
mean, I
finished.
didn't need anything else.
Oh, there we go.
Oh, I'm sorry,
Bye.
I didn't turn everybody off. Later.